Don't forget to subscribe and turn notifications on.
Warahmatullahi wabarakatuh. Welcome to another episode of Crossroads Podcast. Today we do have with us a professional, somebody working for the NHS on the front line in regards to the coronavirus. We have with us Dr. Bilal, who is a consultant cardiologist working at Blackpool Hospital. Assalamu alaikum, Doctor.
Assalamu warahmatullahi wabarakatuh.
How are you doing today?
Alhamdulillah.
MashaAllah, MashaAllah. So let's get stuck in. I know you stuck for time and you're probably busy. So are you on call at the moment?
No. Well, I'm not on call officially, but you still get a lot of calls from friends and family.
Rightio. So let's, obviously, just to make it clear, anybody who's got any queries in regards to what coronavirus is, COVID-19, the information is online, and Dr. Bilal has done this earlier this week. I'll leave a link for that podcast in the description below. What I wanted to ask yourself, Dr. Bilal, is we're quite a number of weeks now into the COVID-19. So a few questions that have come to my mind and people wanting to know is, to begin with, NHS, they're doing a fantastic job.
Yeah.
Everybody within the NHS, they're overloaded. It's hectic. I can imagine it's hectic, and all the news, everything indicates it's hectic. How are staff within the NHS protecting themselves if they're treating patients with COVID-19? The government's telling us we need to be protecting ourselves. The virus can be passed from one person to another. What protection are staff using, or what's in place for staff on the front line?
So we've got personal protective equipment, and the guidelines have been sort of fluid and changing as time's been going on. As of Thursday, the government changed the guidelines. In our own hospital, we've been slightly ahead of the curve in our own hospital, in Blackpool Hospital. On Monday, the medical director made a decision to treat every single patient as a suspected COVID patient. And the reason for that is because, 30% of patients who have COVID have completely no symptoms at all. And of the other 70% that develop symptoms that have COVID, in the first 5 days, they might have no symptoms at all. So there's a very large proportion of what we call asymptomatic spread. So in view of this, on Monday, a decision was made in my own hospital to treat everybody as a suspect in terms of COVID, and we upscaled our personal protective equipment at that stage. So, and for higher risk procedures meaning that where the virus may be transmitted, what we call aerosol transmission. So most of the time it's droplet transmission, the aerosol transmission. So this would occur if you're in an intensive care setting, or if your patient's undergoing resuscitation, or if they're having any sort of surgery done involving, the chest, for example. Then in these sorts of environments, they're called high-risk environments. So in a high-risk environment, you would wear the top level of protective equipment, which would include an N95 or FFP3 mask. You'd have covering of the eyes with a visor, you'd have head covering, you'd wear a gown, you'd have gloves on, and the full protective equipment you would have. And if you are in a lower risk area, then as a minimum, you would have a glove, you would have a surgical face mask, a visor, and an apron. So, that's how staff have been protecting themselves. And there has been a lot of concern regarding the degree of protection and the guidelines as well, and the supply of the protective equipment, because, the whole globe is after the protective equipment at the moment because it's a global pandemic.
Yeah, fair enough. And just on the back of that, so you mentioned the staff in regards to the patient. So obviously you'll have an area, like you just said, high risk area. What is there? Would you say the same things apply in regards to preventing the virus from going from one ward to another?
Yeah. So we have what's called red and green areas, or hot and cold areas, and we try and the patients that are confirmed as COVID or highly suspicious in terms of they've got symptoms and we're waiting for the results back, they'll be kept in separate areas. And then you'll have the green or the cold areas where patients, have come with other problems but have no other symptoms suspicious of COVID. We'll still take the protection as though they may have it because of the asymptomatic spread, but we try our best not to cause cross-contamination within the hospital environment.
And you said is that just your hospital at the moment who's taken that approach, treat everybody as suspected?
So we took that approach on Monday, and the government changed the guidance on Thursday night. So really, others are pretty much following suit with the decision that we made a few days ago.
Fair enough. And right, thanks for that. In regards to your video, just before we mention the video that you did a couple of weeks ago in regards to raising awareness, I must say at the time I was guilty of having a laid-back approach at that time. That was a real eye-opener. When you mentioned Italy and we're getting close to that stage. Based on that, at that time you said, if we don't take the necessary precautions, we'll be in the same state as Italy. Now, at this stage now, we're a couple of weeks in, how is the NHS coping in regards to intensive care beds, capacity and availability?
So at the moment, we're still slightly behind in the north compared to London. So, we're still probably around 10 days behind compared to London. So already, we've been upscaling the capacity for intensive care beds, and in a lot of hospitals, they've taken over areas where you've got ventilators, for example, where no operations would occur. Theatres are now going to be ITU areas, and other ward-based areas can be turned into additional areas to manage COVID on ventilators. So a lot of hospitals have increased their capacity if necessary. So at the moment, most places are coping with the capacity that they've got. And we're expecting the numbers to carry on rising over the next sort of couple of weeks. And really the test will be if we can cope during that period.
All right. So a couple of weeks' time, we may be hitting where London is now, would you say, about 10 days?
Yeah, so I'm thinking about 10 days where London is, and probably the peak that is predicted is probably around, sort of mid or just after mid-April for the Northwest.
Right. Your video did come out prior to the lockdown, I believe, if I'm not mistaken.
Yeah.
Maybe 4 or 5 days, I think it was roughly.
Yeah.
In regards to that, how would you say, obviously, the government initial take on it was let's slow down the speed of spreading the virus, and then the lockdown obviously come into effect. What difference do you think the lockdown has made in regards to the spread of the virus?
Well, so I think it will have helped because a lot of mixing has been forced to stop. However, you've still got, for example, the key workers. So you still got people going to hospital. You've still got people running shops. You've still got people doing construction. And bearing in mind, in like the hospital environment, my argument has always been that you've got to have that additional level of safety in the hospital, because the hospital becomes the super spreader if you don't have, if you don't treat everybody as a potential suspect of COVID. So I think the lockdown will have an effect. And normally it takes around sort of, 3 weeks till you actually see the effects of the lockdown. So at the moment, if you look at our figures, it just looks like they're continuing to grow exponentially. But we would hope to see, the effect of that coming soon.
Right. Okay. And on the back of that, the COVID-19, it's obviously something completely new. It's not something we've expected. Say, it's new to everyone. How we're dealing with it. In regards to the information that we had originally, that it was only affecting people with underlying health conditions, elderly. Is that still the case, or is it also affecting people, or are there cases now where it's affecting people who didn't fall under that bracket?
So originally the impression was that it mainly affects older people or people with underlying chronic illnesses. But that seems to be different, particularly the UK and the US experience appears to be different. There is a significant number of people with no underlying health conditions that have been seriously affected, are either on ventilators or have actually even died. I mean, yesterday we got the news of 2 young nurses in the mid-30s, both of them with 3 children each, who have died, and both of them had no underlying health conditions. In America, there's multiple cases now, and America's been hit quite hard with this, of younger patients with no underlying health conditions. So the idea of it only really hits you if you are old or have got chronic illnesses doesn't seem to be playing out as the virus has sort of moved more west.
Right. So prior to it hit in the West, it was not. It was more elderly people with underlying conditions.
Yeah, so it was, it was more elderly. I mean, in China, you did have some younger people dying in China early on, but on the whole, it was still felt that this mainly affects the old. In Italy, in Bergamo, the area that was particularly badly hit, most of the deaths were in the elderly. I think the youngest person at the time, around sort of 3 weeks ago, when we were looking at the figures, was a 47-year-old paramedic that had died. But now, if you look at certainly UK, we've had a 13-year-old, somebody 18 or 19, and people, in the 30s. In the US, there's a significant number of people in the 20s and 30s that are severely affected as well. Right.
So, thanks for that then. And moving on, is there anything that we've learned from COVID-19 which we didn't originally know? So not in regards to who it's affecting, but more in regards to how we can, more precautions or anything like that?
Yes. So I think as we're going on, we're finding out that, that it seems to be more contagious than it's previously thought, the route of transmission. So, for example, there's a study done by a Far Eastern group that, originally we thought the main spread is going to be droplet spread. So if you cough or sneeze, it's spread by droplets. There's evidence now also that, if you were to cough or sneeze, particularly sneezing, if you were to sneeze, the virus can travel up to 6 meters. And it can also travel in aerosol form. So aerosol form is the most deadly form because it stays around. It can stay around in the air for around sort of 3 hours, unless you've got good ventilation in the room. Then it can have a detrimental effect in terms of catching it. So that's new data and new evidence that's coming out. That might also explain why frontline healthcare workers have been more affected, and also there's to be quite a proportionally higher rate of them being seriously ill and fatalities amongst frontline workers as well. So I think today now we've got 6 consultants that have died. We've got 2 nurses that have died. This is very early on. I know of another consultant, heart specialist on a ventilator down south. Today I've got news of a consultant in Derby who's also on a ventilator. And I think the reason for this is the frontline staff, the exposure they're getting to the virus is more concentrated.
Right. Oof, so that's quite a large number, and that's just yourself, cases that you know of. So there's a chance that there may be many cases that you've not.
Seriously, I think in Italy, yesterday the total number of doctors that had been affected was around, or that had died was over 60. We're still early on here. We're nowhere near hitting what you call the peak at the moment.
Right.
And the real concern is, at the end of this, are you going to find that you've lost, more friends and colleagues that up and down the country in the field?
Right. Okay. And London, would you say they're peaking at the moment, or even they've not peaked just yet?
No, even they haven't peaked at the moment.
So the full country hasn't peaked at the moment. Right. Okay, thanks for that. And one thing I wanted to talk about is...
Going back to that point again. So I think a lot of the, we talk about peak, we're basing it upon any action you've taken before to slow the peak down. So the main action was taken nationally, which was the lockdown, you see. So for anywhere to for that to take effect was when that was put into place. So what we'd hope is that countrywide, the lockdown would have an effect in slowing it down. We're hoping the difference would be that, our peak will not be as high as the peak down south.
Right. In regards to this, like maybe within the NHS or whether it's within the government, do they do they compare any data with the UK as with other countries, Italy, China, etc.? And do they
often, we'll see charts of different countries and tracking them. So when you look at the charts and the tracking, the countries that have done the best out of this are countries like Taiwan, which doesn't even make it on the chart. You've got South Korea and you've got Japan. So in these countries, instead of like going peaks like this, what happened is that they've not got anywhere near a peak. They've remained flat. The main difference in these countries is they've had really stringent measures. They've done a combination of 4 things to really get it under control. And that includes widespread use of masks, quarantining people with symptoms, widespread testing, and contact tracing as well as social distancing. So you put all of these things together with a multi-pronged approach, you can actually get things under control and try and get sort of things moving back to normality. Comparing us to other countries, so for example, if we compare ourselves to Italy, we're following Italy's track. We're following Spain's track as well. And America's actually, a place like New York, for example, is even steeper than ourselves.
Right. Okay. And COVID-19 aside, Doctor, you're a consultant cardiologist, so I'm assuming that's a lot with heart patients, breathing. Is that correct?
Correct. Yeah.
Yeah. So in regards to that, since the COVID-19, obviously, have you noticed a reduction in the number of patients with cardiac symptoms or cardiac condition?
So my work involves patients with heart attacks mainly. So normally you have a heart attack, you dial 999 with chest pain and you come in and you might have a blockage and we would open that up. And normally it's a very busy service, but we've noticed, and countrywide, we've noticed that over the last sort of 3 or 4 weeks, the numbers are very, a significant reduction. In our own centre, we've noticed a reduction of around sort of, we've got about 33% less number of patients coming through the door with major heart attacks. So we're thinking that a lot of people are staying at home and ignoring the symptoms rather than actually, coming to hospital and dialing 999. And that might well be because they've been told to stay at home. They might have the symptoms and they're ignoring it. They might not think, they want to bother the health system, and they might play their own symptoms down because they'll be scared. And I think the really important thing to get across to people is that, we're still there to treat your serious conditions. Heart attacks are a very serious condition. Heart attacks are dangerous, and we're there. The teams are there. We have the protective equipment to protect ourselves and to protect you as well. And if you do have symptoms of chest pain, chest heaviness, tightness, you feel very unwell with these symptoms, you still dial 999 and you still get the treatment, and you still get the best treatment as well. That's really, really important, that despite the pandemic, it doesn't mean that we're not offering, the treatment for these other conditions. And something like heart attacks is very serious, and cardiac conditions, kill several hundred people every day in the UK. And it's important for people to understand and realize that these are serious conditions. We are treating them, and they must seek help for these, rather than thinking that, we're not treating these anymore, or they're staying at home and they're just braving it out. Very, very important to get that message across to people.
Yeah, definitely. So for the viewers, that if you do have anyone or anyone who do suffer, who have had history of heart attacks or anything of the sort, if they do experience any pain, do get them to follow the normal procedure, which is dialing 999. It is very important for them to get the help, because I think a lot of with the news and everything, I think people might think they're a burden, even if they do have the symptoms. They might think they're a burden. They don't want to, and we are hearing constantly about the NHS, how, the workload, you're pressured, you know what I mean? And I think some people do have, even though their intentions are good, they do need to look at the bigger picture in the sense that, like you said, heart attack is a quite fatal.
Correct. Yeah, absolutely true. And, you know, you're not a burden at all. You know, we're there to treat these conditions, and, you know, you should dial 999. You should come in and you will get sorted.
Perfect. So that's all the questions I've got for yourself today, Dr. Bilal. Thank you very, very much for your time today. And hopefully in the near future, once this is all calmed down, we can have another chat and maybe talk something more specific to your field of work, cardio as a cardiologist. So that I do look forward to that. Hopefully, if
you know, I'd be more than happy to do that.
Perfect. Thank you very much for your time, inshallah, and hopefully we will speak to yourself again soon.
Thank you very much. Salam.
Thanks for that. Where's it gone? How do I stop the recording?